Let's welcome Dr. Dianne Caprio from East Carolina University School of Dental Medicine's Community Service Learning Center. Welcome, Dr. Caprio. It's nice to have you here. For our viewers who maybe haven't met you yet, can you tell us a little bit about yourself and your background?
Sure, Amy. Thank you for having me. It's always a pleasure to come and talk about ECU School of Dental Medicine. I'm a dentist, and I'm the director of one of the clinics that ECU built down in Bolivia on the Brunswick Health Center campus.
Perfect. Very good. Right there beside the hospital, the Novant Health facility.
When you turn into the hospital, you go to the north side of the campus, and you cannot miss our building. We are right there.
Very good. Very good. And tell me now, when did the center open? It's been a few years now? Or?
Actually, next month will be our 2-year anniversary.
Okay. Very good. Very good. Time flies.
It does.
And we were very excited to hear that that new service was coming to the community. So I'm excited to learn more about how it's going now. Has the center been busy? Has the community been real responsive?
Very much so. It seems like every month we get busier and busier. And for those who really don't know much about the school, the main campus is up in Greenville with the rest of the ECU Pirates. But when ECU built their dental school, they had a vision of reaching out to some of the more underserved areas of North Carolina. So they built 8 clinics and spread them across the state. And one of them is here in Brunswick County, which is wonderful. And as the word gets out, people have been very excited, very enthusiastic, and very supportive of the clinic.
Very good. Well, I know I see people driving in and out of there all the time, and usually a little confused. It does take a moment to figure out which way to go, but once they do, they know right where they are.
Very easy.
So tell us about, you said you're the dentist at the clinic.
I'm one of the dentists. We have 3 faculty dentists on staff, and I also have 17 permanent party present at the clinic every day. As far as providers
so is that
go,
permanent team members? Is that so
those are
staff?
Dental assistants, those are front office business managers. But as far as providers go, I have 2 registered dental hygienists, and then I also have 4 D4 students. Those are senior dental students. They spend their first 3 years of doing intensive training in Greenville before they come out to the clinic. The 4 students spend 9 weeks with us in Brunswick before they rotate out and go somewhere else, either to another clinic or back to Greenville. But I also have 2 full-time licensed dentists who are doing a residency in advanced education in general dentistry, and they are with us for 1 full year.
Okay, so they're out of school practicing dentist, and this is kind of a special advanced training
They're
for
doing
them.
more of the complicated cases.
Okay, wow, that's awesome. I did not realize that was a component of the program. Very cool. So you have the 4th-year students, the hygienists who are permanent there, and then the 3 dentists.
3 faculty dentists.
And you're permanent, but the other 2 would change and rotate out.
The other 2...
The other 2 dentists?
No, they are permanent party.
Okay, they're permanent as well. Okay, I thought since they were doing sort of a residency that they also might...
It's a little confusing, but there are 3 permanent faculty and there are 2 residents.
Right. Well, I think that would be reassuring as a patient going there to know that you've got some stable
continuity of care.
Right. Very good. So the students, let's talk about the 4th-year students, because that's such a cool aspect of this program, I think. They're here for 9 weeks. Do they live in the community while they're here?
They sure do. The school has rented a house in Brunswick County, and the students live there, and they get out into the community, and they're fairly active. Every single one of them volunteers at the New Hope free dental clinic.
Oh, how cool.
So we will spend 4 to 6 evenings a month over there at the New Hope Dental Clinic.
Very good, very good. That's great to hear. I mean, we are very supportive of the New Hope Clinic and have had them on the show as well.
Yes, so. It's a wonderful place.
So much outreach to the community that you guys are doing. So I know with ECU you talked about all the dental service learning centers. Do they see this as a way to get the students to relocate to these areas to ultimately?
Oh, absolutely. I can speak for Brunswick. I know in the short time I've been here, I've seen 4 ECU students settle into the community.
Wow,
and
that's
I know
amazing.
One more coming,
That's great. That's great. What a neat program and a neat way to recruit to these areas that, Well, we've got the beach, but I know sometimes can be less popular since they're more rural.
Yes.
Very good. Well, let's talk about from the perspective of a patient, someone who might be interested in coming to the center for dental care. I understand there's some financial assistance available. Can you talk about how that financial structure works for patients?
Well, first of all, our fees are generally about a third less than those in private practice. Okay. And then ECU offers a payment plan that's their own particular plan.
Okay.
We are Medicaid providers, and we do accept all dental insurances. Now, for those patients who financially qualify, we do offer a reduced fee schedule. We have a patient care fund where they can get up to about $1,000 towards a particular procedure. And then we also have teaching cases. So a particularly interesting case for one of the residents, we can fund up to maybe $1,500 towards the procedure.
Okay. So talk about, I mean, I guess it's everything from regular, your twice a year dental visit to much more complicated things, right? So talk about that kind of breadth of services.
Well, we are considered a full service clinic, so we'll see the very young child all the way through our senior population, everything in between. And we do the preventive procedures, cleanings, fillings, anything restorative, of course, and then we do dentures, partial dentures, root canals, extractions, implants. So we cover pretty much all of the dental services.
Anything orthodontics at this time?
Very limited orthodontics. That is in the plans, but not for a few years, I think. But very limited, space maintenance, things like that.
Right, sounds good. Sounds good. Well, it sounds like really just a wide range of services and a great staff, great service to our community.
Thank you.
If there is someone watching who's maybe interested in calling, learning more, making an appointment, is the best thing for them to just call the center and make an appointment?
Well, that's probably the easiest way to do it. You can call, you can certainly come in and visit us, and we'll be happy to give you the information. You can also go online, the ECU School of Dental Medicine, and make an appointment.
All right, wonderful. Well, thank you so much for joining us today. It's been a pleasure to meet you, and really thankful for the service that you're providing to the community.
You're very welcome, and thank you for having me on. It was nice meeting you as well, Amy.